Hello everyone, welcome to another episode of the Quarterback Dentist, and we have a great guest today. I'm here with Dr Ahmad Al-Hassiny from New Zealand, and we have a great topic that I'm sure that we are going to enjoy a lot because we're going to be talking about the digital dentistry, the two main ways. It's about the same day or quadrant dentistry and the interdisciplinary planning. Basically, the two main approach that dentists are executing in the digital environment. And I think that it's great because basically you represent one or you promote one, and we represent or promote another one, and there's no A or B. There's also a lot of connections, and I think that's the main goal of this episode. When to go in one way, when to go in the other way, what are the advantages, what are the weak points, and how to make this also something very profitable in our daily practice. So first, Ahmad, if you can introduce yourself so our audience can know you a little bit more and value more all the knowledge that is behind this guy that is in the screen.
Thank you, my friend Luken. It's a pleasure to be here with you. Everyone, my name is Dr Ahmad Al-Hassiny. I'm a dentist based in Wellington in New Zealand, very far away, literally almost the opposite side of the globe where Luken is. And so originally I'm from Iraq, actually. I came to New Zealand with my family in 1993. So we've been in New Zealand a long time. It's where I did my education. I got my dental degree here. And yeah, I graduated about a decade ago. I went into private practice with my father and my brother. And my mother actually is a dentist. We're all dentists in this family. So our dinner conversations are really interesting. And so we operate a family business of around 41 chairs. I'm super into digital. Ever since I graduated, I've run the Institute of Digital Dentistry, which is like an education platform for digital. And I speak around the world about this topic. Luken, I'm just a crazy guy, man. I really love dentistry, honestly. It's like I feel like it's one of the best jobs ever. I love it, and I'm so passionate about it. And I think you're the same. A lot of us guys that are really pushing digital, we're just really passionate about this.
Yes, I think passion is the word. When we're not doing this because it's our job, it's because we really believe in this and we think that is the way to go. And we think that we can change many things in the dental environment, even in the world, in our patients, if we go digital. So let's go and let's start with the content because we have a lot of things to discuss here, Ahmad. And what does digital really means in your daily practice? How your daily practice looks like in the digital environment?
Yeah, I mean, look, it's a good question. I think this is one thing that everyone talks about digital everywhere. Everything is digital and all the expos. I think a lot of people don't realize what digital dentistry really means. And it doesn't have to be anything fancy. Like, I'm a clinician still working full time. And to me, digital, it really comes down to the basics. An intraoral scanner. An intraoral scanner in my practice is used every single day, multiple times per day. Whether I'm doing a same-day crown, whether I'm doing orthodontics, whether I'm doing implantology, anything. And it's like what we talked about in the last episode, Luken. Digital dentistry impacts every single part of dentistry. It is not some, unique, different category of dentistry. It is the way we do things now. And so for me, as a general dentist, I'm quite lucky. In our practice, we literally interdisciplinary. So I personally place implants, I restore implants, I do orthodontics, aligners. So I see digital dentistry from many lights. One of the most common things I do, even though I love implants and these things, is same-day crowns. As simple as that is. Quadrant dentistry, which I still think is one of the most profitable things dentists can do. It's the most accessible because, let's face it, not every dentist is going to do aligners and smile design and cosmetic makeover, but every single dentist can do a crown. And so for me, almost every single day, I am doing same-day crowns. And I have my team that is highly trained, and I can prep a crown, scan a crown, design, mill, cement, and Emax restoration within about an hour to an hour and a half of chair time. So I think when you get to this level of digital dentistry, it becomes like a well-oiled machine in your practice. And And this is when it really becomes fun because it's no longer stressful. Like I remember the first time I got into digital dentistry.
No, definitely. And we were talking about in the introduction about the passion, and I think that the main reason why we are in this is because we learn complete analog. So in my case, in your case, I did my postgraduate in prosthodontics, and I was focused. Everything was analog. So the first time that I saw a 3D printer or an intraoral scanner was after I did my postgraduate. So that's why I think we are too pushy on this. It's like imagine when I was studying dentistry with all these devices, with all this technology, the world was completely different. No, so I think that was the main reason, because we know the other side of the story. And
I'm curious, Luken, sorry to interrupt you. I'm curious, did you guys place any composite? Because when I graduated, and that was only like 9-10 years ago, everything was amalgam. There was no composite, not even a scanner. It was all amalgam.
I want to give you a very quick summary of my background, because I did dentistry in Venezuela, in South America. And the level of education in dentistry there is very, very high. I mean, I did amalgam, I did composite, I did gold restorations. So I did everything. If you want to get to receive your diploma, you need to do around 50 extractions, and you have a amount of number of crowns and restorations. So at the end, you have to do a lot of clinical execution. That is something that nowadays I'm not seeing that, for example, here in Europe. So basically, when dentists get out of the career, it's like a mandatory to take a postgraduate if you want to feel confident or you want to do something in the patient mouth. And when I finalized dentistry, I was completely ready to do a good dentistry, of course, not at the highest level, but I was ready to be very good with surgery, with extraction, with restoration, with crowns, with bridges, with temporary removable restorations, full mouth. And I'm sure that also the industry is pushing that. No, it's also education is also a business. So you do your career, then you don't feel completely ready, so you need to do a postgraduate. So then you need to do a second postgraduate. So nowadays there are people who have 3-4 postgraduates. In my time, that was completely crazy. That was almost impossible to do it, right? And well, but just to answer you that, yes, I did amalgam, I did gold, I did composite, I did metal ceramic, and I did basically a little bit of everything. And as I said, this is why I value so much what we are doing now. Now it's very predictable, very simple, easy to understand, easy to explain to the patients, less repetition. It's everything that we can talk about digital dentistry is good, right? So, Ahmad, how looks your daily practice? What is the process? What is your sequence, your normal sequence with your patient? You say that you are very focused in the quadrant dentistry or one-day dentistry. So, patient arrive, you take the initial records, correct? What type of records you take in an initial appointment?
Honestly, it depends what I'm doing it for. And so, because I work in New Zealand, I'm not in a, like Hollywood clinic or some, I treat the middle class, low class, high class. I have a range of patients in my practice. Now, what records I do, it depends what I need them for. And I think that's really key as well, because there's no script. If you understand the output of where you're trying to go, what you're trying to achieve, then you can work backwards and take the appropriate records. I'll give you an example. If a patient comes, cracked tooth syndrome, broken, heavily filled, and needs a crown, I don't need very many records. I can execute very quickly on the same day a single visit crown, design it with CEREC or AI or anything I choose these days. I prefer CEREC because I feel like it's the best same day workflow, but I know it's very expensive and that makes it prohibitive. But regardless, for a case like that, you don't really need a lot of records, let's say. However, on the other side of things, I also do removable dentures. I do smile design. I do cosmetics. And so let's say a patient comes in. They come in for a veneers consultation. In that case, the record process has completely changed. In that case, the record process becomes like a comprehensive examination, photos, videos, face scan, x-rays, etc. And from there, we will take all that data and make a smile design mock-up in the same way that Christian pioneered. As you know, the guy is a genius. He came up with the best way to do smile designs. Design it, print it, bring the patient back, transfer that to their mouth, and then you can close the case. And this actually happened to me a few days ago. A patient came in, we transferred it to the mouth, they're amazed, they're shocked, and they're keen to start. Compare that to an implant procedure. An implant procedure is totally different. You would bring the patient in. Maybe you don't need face scans if it's just a posterior implant. Maybe you need a cone bead, a scan, and then we'll use these scans to make a surgical guide. You'll print the surgical guide and use it in the mouth. The other thing is if a patient just comes in for a routine dental examination. Routine dental examination, it really depends on what you want to do in your practice. A lot of people scan every patient because it's a very valuable resource. It's a very valuable teaching tool for the patient and also a record. Because if you have a patient that has wear, this is something you guys teach a lot about because you talk about full mouth rehab and interdisciplinary complex cases. For these patients, if they're not quite ready to treat the problem, scanning them every year at their examination can help you highlight that there is actually degradation going on, that there's actually tooth wear, versus a patient who just comes in, they're healthy, they're coming for their every 6-month check. It doesn't mean I'll be taking face scans for these people. So to me, genuinely, I tailor the records depending on the patient that comes in the door. There is no script. I think more important than have a script or a checkbox that you just tick, oh yes, I took a face scan, I took a scan. Understand where you want to end up. What are you trying to achieve? And you will understand which records that you need to take.
And who take those decisions? Who is the one that decide this patient goes in this way, goes in that way, we're going to do this is the records that we need? How is the process in your practice?
Primarily, it's me. Primarily in my practice, it's me. We don't, unless there's a really complicated case. In my practice, we have 8 dentists just in our one clinic, and we do a lot of group training between our clinicians and case studies, and we share cases. I think this is one of the key and most important things of being in a group practice is finding a very good mentor and a healthy environment where you can share cases. Because I think this is where you're leading to, Luken, about the interdisciplinary approach and why it's so important to share with your colleagues. This is what we do as well. But I think, basic cases, I'm at a point of my career, I wouldn't say I'm anywhere near close to an expert. I'm not, but I'm also not a new graduate. And so when I first started in my career, I used to have to ask for a lot of help from my father, from other colleagues, senior dentists. Now, if it's simple cases, I will be carrying out all the treatment decisions myself. If it's complicated or I feel like, I would value someone else's opinion on this, this is where digital records become even more important because you can share these with colleagues. If you don't have colleagues inside your own practice, you can share that easily online through the cloud. And I think this is where the interdisciplinary approach comes in, because as much as there's always a benefit of another perspective.
Definitely, and we're going to jump there in the interdisciplinary, so then we can compare more. Going back to the quadrant or the same day, why speed and autonomy matters for you?
Yeah, look, I think speed is critical. I think for ROI, it's important, but the key thing about speed is it's important to have speed, but preserve quality. You can't just have speed and be reckless and you're doing a bad job because of lack of training and these issues. But I really do believe speed and delivering quickly is important. There's a famous saying, Luken, the only thing better than free is fast. And we can see this all around the world. you pay for Amazon Prime so you get your deliveries faster. You'll pay for this so you can get something faster. We live in a world where everyone is busy. Everyone has jobs and kids sports and these things. And to me, what's so important about same-day dentistry is I can execute a case and completely finish it very quickly. There's no more temporary fillings. There's no more debonding of temporaries. I promise you there's a lack of sensitivity with crowns because, although you guys are a very high level of clinician at DSD, the average dentist doesn't make the perfect temporary crown. Often it's shrink fit, there's leaks, there's issues, there's sensitivity. And I really think that same-day dentistry helps us solve a lot of these issues. One other thing I'll share is never underestimate the psychological benefits of same-day dentistry. And what I mean by that, they may sound crazy, is like what we talked about in the past episode about stress. I really believe there's a psychological benefit of finishing a case on the same day because it's done. There's nothing that feels better. The patient comes in, you do the job, you cement it, you take the x-ray, everything looks good, job done. Versus, you're worrying, you're thinking about it. Oh, there was an overhang on my temporary crown, and you're worried about the lab work coming back, and, did the impression get lost, and all these stresses. So I really love same-day dentistry because it has totally changed my practice. And I think I saw a survey, just like you, we go to these conferences, and there was a survey done by Ivoclar, and they interviewed thousands of patients or something like that, and they asked them would they change dentist if they could have their restoration in the single visit. And I think something like 66% said yes, something like that, like a majority. And I think if I was in the same position and someone told me you can have a crown within an hour, 2 hours, or you have to go and come back and make another schedule in your appointment, etc., I know what I would choose.
Completely agree with you on that. And I think that the majority of the dentists that are doing digital dentistry, they are focused on this. And I think this is how the industry started, digital dentistry. This is how CEREC started. There was one machine that you scan and mill in the same device, And at the same time, I think that was the reason why the evolution of dentistry into digital was too slow. Because then it depends 100% on the dentist. Because you need to have the equipment, you need to have the knowledge, because you're saying in 1 hour you can do a crown. But it's not to scan, jump, and bond. There's a process, there's steps in the middle that is not, let's say that the learning curve is, not say is very tough, but it's a process. So it's not only a device. So digital dentistry is not only having a device, because someone needs to manage that. If you want to do one-day crown, you need to have the scanner, you need to have the skills to design or the softwares to design. Then you need to have some knowledge on the finishing and the stain and glaze and the oven and the lab and the ceramics, or someone that's going to do that job for you. So I love the one-day dentistry, but we need to understand that there's a lot of things or steps involved in the process. So it's not buy the 3D printer or the milling machine and it's done. It's not as easy as that.
It's not magic.
And that's why many dentists are afraid to that, because they said, I prefer to do my crown in 2-3 appointments, but then I'm not going to spend the money and the time and the learning curve. And that, I think, is not the right way. Definitely, we need to go 100% on that. And let's move into the interdisciplinary and the big picture model, because I think when we introduce somehow this way to go, then we can start to also debate a little bit more about the pros and cons of each one of these situations. And from our point of view, and one of the main focus of DSD is on this, is in the interdisciplinary approach. And the main reason is that patients need more than one thing. The patients that are coming only for one crown, they can only get benefit from different things. Maybe they can have some aligner movements. Maybe you can modify somehow the gum in some areas. Maybe you can improve the function doing something different, or maybe you can improve the aesthetics doing some gingivectomy or some restoration. So I think the quadrant dentistry is more to do what the patient wants. No, I come in here because I want this. You go there, diagnose, design, plan, execute, and it's done until the next time that you need something else. And the interdisciplinary approach is I want to see the big picture. I want to analyze everything from yourself. It's not only the crown, is the articulation, is your I forgot. Is your airways, because it's not only the crown. Maybe the crown, you have an issue because you have another extra problem. This occlusion is the airway. So we analyze everything. We create the best treatment plan possible for this human being. And then we present. I say, dear patient, this is everything that we can improve in yourself. And it's up to you now to decide what you want. I presented all these are all the issues that maybe you just want to do the crown. That is okay. But if in the future something goes wrong, remember that I told you that there are many things that we need to improve. And for me, or the next evolution of digital dentistry is there. But at the same time, what I mentioned here, that sounds very quick, very simple. There's a lot of steps and a lot of knowledge that you need to have to feel confident to present a full, complete interdisciplinary plan to each one of your patients. And it's what you said, it's about experience. So that's why, and when we are starting, we are more focused in more quadrant dentistry because they're not too much diagnosed. Patients coming with pain, solve the pain, you put the crown and it's done. And when you start to evolve and get more experience, you can see more the big picture. If the patient comes with a cracked tooth, then you realize that maybe it's because the articulation is something, and then you start to connect dots, and then naturally you start to bring those interdisciplinary plannings. So the question is how to move from quadrants to the interdisciplinary approach. Is it something that every dentist should move into? Is something that it's easy to do it? And I make the questions, and I want to give you also my point of view, and then I want to hear from your side. And definitely, the hardest part there is the knowledge. And it's the same as the quadrant. You need the equipment, you need the software, you need all the same process, but now you have an extra barrier there, that is you need to know and you need to learn how to connect all the dots to see how it's going to affect. If they do an ortho, how it's going to affect my aesthetics, how that's going to affect the airways. So that knowledge is the hardest part. And the reality is that it's so hard to know everything about dentistry. So I think that's the reason why dentists are, I think the big majority are more focused in quadrant dentistry than in the interdisciplinary. What do you think about this, Ahmad?
Yeah, no, I totally agree. I think a whole picture approach, like you say, it's very difficult. It needs years of education, years of dedicating your life to learning. The other thing, I think it needs to be done in a very classy way. Like when I reflect as you're speaking, because I don't think there's any way to disagree with you. I think the best treatment plan, if I was a patient, I want the dentist to look at everything. At the same time, I think a critical thing is you need to have a receptive patient, because I think about my patients, and of course this comes down to the dentist and how they present the information. But some patients, if you don't have a receptive patient and you treat every single patient like this, some people, if you don't do it the right way, will see this as a big sales pitch. It's like some patients genuinely, they come in and they already don't trust dentists, especially in markets like Australia and New Zealand, where it's completely privatized or by health insurance and can be expensive. I think globally dentistry is expensive anyway. But a lot of patients have this kind of idea that dentists are trying to rip them off, trying to find stuff to make money from. And to me, it's tricky to teach interdisciplinary to everyone, because I think another key important part of that is not just the knowledge, it's not just the knowing what you're looking for, but it's communication. And I think a critical skill in dentistry that's overlooked is communication and presenting, a problem list correctly, accurately, in a way the patient understands. And also, I think dentists need to understand, I reflect only on my own experience, because when I graduated, I did a lot of new patient exams and had terrible case acceptance. I couldn't even get a patient to say yes to a crown. Because, when you're a new undergrad, you don't really learn communication. The patients come in, it's cheap dentistry, and you do the problem list, which is like 5 pages. That's not the way to do it in real life. And I totally agree, interdisciplinary is the right way. But at the same time, I feel like it's a tool in your arsenal, and you need to know when to use that tool. Sometimes patients, they, even with informed consent, they really don't want to know. They feel like you're overselling if you do it too much. And in the same way, it's up to us as dentists to serve our patients in the right way.
Yes, and partially agree with you, and with the topic of how to present is a key topic. It's a topic that we emphasize a lot. Basically, it's the main topic of our course, is that the communication. And it's not only communication with the patient, it's communication with your team, it's communication with your lab, it's communication with everyone. But the communication with the patient is critical. And I always ask in the courses to the people if they ever took a course about that, how to present a treatment plan, how to build the good treatment plan. And no one raised their hand. And I said, like, but I'm sure that you took a course about how to make a minimal invasive preps and how to do immediate dental sealing and how to place the immediate implant. And then I said, but if you don't present it the right way, the patient is not going to accept. So then you are not going to have the possibility to execute all these great things that you learn. So that's why when we talk about the interdisciplinary, we divide it in 2 big moments. Is the pre-case acceptance and the post-case acceptance. And pre-case acceptance is everything that we need to do to try to educate the patient, to convince. I don't like to use the word convinced, because I think it's more to educate, to make them understand what we can do in the best way possible. And then they're going to accept what they consider, what they want, or that what they can afford. And then you move into the post-case acceptance, that is the execution of what the patient accepts. And for that, and I was waiting to create this discussion, because as you said, in the Quadrant Dentistry, everything depends on you and your hands. If you are not there doing the first appointment, you need an ultra high skilled person doing that filter to decide this patient where should go. In the interdisciplinary approach, we have a checklist that is completely straightforward information, a standardized protocol that anyone can do. Even ideally, the staff can do that. And then with that information, you can analyze each one of the cases and decide where to go. So you have everything is like having the head of your patient in your desk, and you say, okay, this patient go in this way, this patient go in that way. So then it's not going to depend on your skills, because you have the information. You can be here in Madrid with us in our facility, and you can be reviewing cases. Say, guys, team, this patient, keep it there because next week we're going to be there, going to do the crowns. Or that patient, I think we should start with the ortho treatment, so send this to my brother. Or we need an implant first, so my dad is great on this. So I think one of the big benefits of the interdisciplinary approach is that force us to document everything in a way that we can see better, we can see more, we can diagnose better, and we don't need that extra pressure that everything is going to be over our shoulders, because we can share. You have a case here, I have some doubts, I can send you a quick folder or a quick PDF. In 30 seconds, you can review the whole case. I look and, I think the right approach for this case should be this, and that. What is the issue on this? As you said, patient wants something as fast as possible. So then come back to the topic that you said, it's about communication and education. You need to make the patient understand the value of this. They need to see that doing in this way is better for them. And not every patient is open to this. So I 100% agree with what you said. It's another tool in your toolbox. And in my hands, the first approach is that. And if my patient don't want that, I say, I don't care. Thank you for your effort. Thank you for all your knowledge, but please, can you just change my career? The only thing that I want. And then it's okay. Then you have the whole tools, and then you go into the quadrant. But what is the big barrier here is that you need to have a very good, cool, standardized workflows. If not, don't want to worry, because quadrant dentistry depends on you, on your hands. You can close the circle completely. So you have the control. You know exactly what you are saying to the patient, what you are diagnosing, how you're executing, and what you are delivering. In the interdisciplinary approach, there are more people involved. And you involve the lab, the team, the specialist, the diagnosis. So if everyone is not very well coordinated, then can even be worse the solution than the initial problem. So I think that there's no one way or the other way. You mentioned something that I think is very delicate also, is the countries, the situation. And I hear that a lot from also people that take our courses. Like, look, and my patients are not open to that. And then I come back with the topic that you mentioned, but how you are presenting, how you are talking to your clients. And then somehow they start to learn how to do it, and they start to bring the right type of patient that they want. So that's also another topic. What type of dentistry is the one that you want to do? You want to do full mouths, you want to do full complex restorations, or you want to do cosmetics, or you want to do a quadrant, or you want to do only ortho. So that's also relates to education first, learning what you want, have a very clear goals, and then create your steps for that. What do you think, Ahmad?
Yeah, I totally agree. I think the fundamental thing that keeps coming up is communication. And, it's interesting that I think we talked about it last episode. What's the most important course that I've ever done? And what I should have said is a communication course, because actually that's probably been the most impactful of any training I've done, because it's, you said it right. If you can't present the case correctly, if you can't present the treatment plan correctly, if you don't even know what you're looking for, how do you get the patient to accept treatment? It's not possible. At the same time, you mentioned a great point about the team, because I think the team is critical in this. And this can be hard, Luken. I know DSD, I think, I don't want to say you guys are elites, but you're very, very accomplished group of clinicians, and you tailor your courses to a very high level of dentistry. And there's no doubt we should all aspire to that level. At the same time, I think a lot of people may not have the resources to do this. I'm not going to say this is an excuse, but you need a very good technician. You need a very good team. You need a very good staff with you. And so I imagine some associate who maybe this is their second or third job and they just work for their boss, and their boss says, we don't getting an intraoral scanner because this is my rules. It can be very hard for them. You really need to build this level of dentistry. It needs a lot of effort and work, but it's definitely something we should aspire to, because I genuinely believe this is the way dentistry should be practiced. At least case select, and at least be prepared to present this to patients who are open and receptive. Because I can tell you, and it may be, look, none of us are perfect, and maybe how I present as well, and everyone can learn and be better. But there's definitely some patients that will find this like a sales pitch. They'll think you're just talking too much. And I feel like another important skill is knowing when to stop as a dentist, reading the room. When you're presenting to a patient, a key communication skill is realizing when the patient is switching off and they're not engaged with you. Like in any treatment plan and any presentation of treatment, the patient should be engaged. If they're looking around and they're not really engaged with what you're saying, I think this is a really clear time to stop and reevaluate, rather than go through the whole script and then wonder why they didn't accept treatment at the end of it.
And you said the communication, and not everyone is good on that. And of course, there are some skills that you can learn, but they're not a skill that you have it or not. There are people that are not good just connecting with people, and those are not the best for presenting treatments. There are ones that just with a paper and with a pencil they can sell whatever, and as you said, it can feel like a sales pitch. That's why we need to play some different tricks there. We need to play with the psychology of the patient. We need to use a lot of images that demonstrate what we are doing, because at the end, we always talk with the patients and we think that they know what we are talking about. No, we're going to do a lithium disilicate veneers and we're going to do a crown with an angle at 30 degrees abutment of titanium. And the patient say, yes, yes, yes. And the reality is that they have no clue what we are talking about. And many times patients are not accepting the treatments, not because it's too expensive. One of the main reasons why the patients are not accepting is because they are not understanding what we are talking about.
Yeah.
And that's a reality. And because we don't know how to talk about dentistry to not dental people. And we are, as I always say, we have a tool in our head. And when we are talking to another dentist, we are great. We can spend hours. But when we have someone external of dentistry, they get completely lost. Like, guys, you are so boring, always talking about tools and things. So, yes, for me, one of the conclusions is that the communication is learning, and you need to have that sensitivity to understand who is sitting in front of you, what is looking for. Can you move in that way, or you need to stay here, do something, prove, earn trust, and then jump into the different area. Ahmad.
How I put it to my associates, I think one of the critical skills in communication and any sort of dentistry, whether it's high level or basic dentistry, I see our roles as dentists is to identify problems and deepen concern for the patient. That's really your role.
Yes.
And because if a doctor told you you have a cancer in your lungs, there's no way in hell that you wouldn't go and get treatment, right? We would all get treatment. 99% of us would rush. We'll drop everything and get treatment because you have a very high level of concern. If a patient has severe issues and you can't get them to accept treatment, it's like you said, they don't understand. You didn't present it in the right way. You didn't deepen their concern about the real issues that you know as a dental person, but they don't understand as a person who, like you say, doesn't have a tooth in their head.
Totally. And that sensitivity to see, to understand, to decide, and then define what workflow you are going to take. Jumping into another topic, Ahmad, what have been the biggest innovation you have seen in the one day or quadrant dentistry? I think I know you already mentioned, I think, at the beginning of the session, but just to emphasize for you, what is that thing that changed everything?
Yeah, look, I would honestly say that I feel like the most useful thing to me in the same day dentistry, and look, I think we're talking about two interesting topics here. I think when you say quadrant or dentistry versus interdisciplinary, I think it's almost like single tooth dentistry versus full mouth dentistry, like looking at the whole picture. What I'm talking about with same day dentistry is a little bit different because I don't see it as a single tooth dentistry, because even for our rehabs, we can now deliver them in a single visit, because if you have a technician with you in the setup. But I would say, look, speaking on the single visit dentistry topic, the most important thing I found is genuinely AI, I think, is probably the biggest thing. And what I mean by that, because AI is now a big buzzword in dentistry. Everyone's talking about AI. But CEREC has had some of the best AI on the planet in their CAD software. In chairside CEREC, it has some of the best AI, because if you prep a tooth well, it will design a crown for you that is 90% good. You barely have to touch anything. A lot of people are so scared of CAD CAM because they think it's very complicated. And I agree, look, it is a learning curve. It is challenging. You will probably spend 3 to 4 months learning But I think what we underestimate is how useful AI is nowadays, because it's been in CAD/CAM for a long time. So if you invest in the CEREC, you get very good AI. But I know a lot of people can't invest in CEREC because it's expensive. Then look at other avenues. There's 3Shape Automate. There's DentBird. There's a lot of AI now that is bridging the gap between scanning and manufacturing. Because I believe, look, you said you use ChatGPT. It's amazing. It's mind-blowing. It's, they say that ChatGPT can pass a law exam. And I think if it can pass a law exam at university level, it can design a single crown. The key part now is, though, the key part is AI is, again, just a tool. And if your preparation is not good, it doesn't matter how good the AI is, the output will be terrible. And I think if dentists spend more time with the design of their preparation, of correct preparation, making sure they do not under prep, then the whole process becomes easier.
So I think you're answering also the next question, that is, what you consider is the biggest challenge for dentists to implement the one-day dentistry. And I think
and we talked about it earlier. I really believe there's two main challenges. Financial. I think this is one of the biggest challenges because it costs a lot of money, and traditionally it costs a lot of money. Now with the 3D printing boom, I think this financial barrier has really reduced. Before, to get into CAD/CAM or same-day dentistry, the only option was a milling machine. A milling machine starts at 30 to 40,000. This is beyond what dentists want to pay for same-day dentistry. If you want to get a CEREC set up, it's around 120,000. So you have to be really, really into this and believe in this to spend that money. But now with printing, a printer can be 5,000, 6,000, 10,000, 2,000. And so now the financial barrier is going down. Then there's the other barrier, which is the education and like you say, it's just the intimidation of technology, I think it is. Because this technology can be very intimidating, especially for older dentists who may not be so tech savvy. And like us, we grew up with at least a computer, I believe. I don't know about you, Luken. I'm quite...
no,
I'm 32, so I didn't grow up with a smartphone, but I grew up with a computer. And I think this is the two main barriers: money and intimidation / the right education to learn this technology.
Yes, and I'm 10 years older than you, so
you look young, man. Lucky. It might be these genetics.
But I also learned with computers since very earlier. And the thing, I agree with you. Definitely, the money is a barrier because first, we don't know about numbers. We are not expert in finances. There's another weak side from dentistry. And then it's so hard to know the perfect combo, let's say, that you need. But first, I consider that the mindset is the first challenge, because when you get educated, when you understand the value, when you understand the potential, the power of doing digital in Quadrant or Interdisciplinary, I mean digital in general, then you find a way. Because at the end, in dentistry, we invest a lot. We invest in courses, we invest in the staff, we invest in equipments, in technology, we invest in the chair, we invest in our facility, in the place, in the marketing. So this is all about to prioritize. And when you have that mindset and you can see that that's the way to go, then you just change priorities and you just move on there. And you also mentioned that, for example, the CEREC is around 120 around, but nowadays there are more affordable options. For example, I don't know, the VHF milling machine, the E4 is around 16 or 20,000, the milling machine. And intraoral scanner, you mentioned from 6,000 to 30,000, then you can connect. Then the design is depending. You want to design the full mouth cases, you want to divide yourself, you can go and make the step by step, or you can go with AI. And even the next step is, if you don't want to manufacture ceramic restorations, you can go with a 3D printer like the Midas. Midas comes to challenge also the milling machines. It's like I always compare that the Midas is more than a 3D printer, is in the category of the milling machines if you are thinking in final restorations. So imagine in the past you need to spend around 70,000 for or 80,000 for a milling machine and CEREC. Now with 10,000 you can have a device that can print restorations. Are exactly same as the ceramic. I think it's a hot topic nowadays. It's so new, it's coming. We need more research, but it's there. And if it's not 100% ready yet, in few years, it's going to be there. I'm not saying that milling machine is going to get obsolete. Of course not. I'm just saying that it's another option. And one more time, it's
Yeah.
about your preferences, what you want, what you are doing, how often you are doing restoration. If your clinic based it on cosmetics, so then definitely you need to want a milling machine. If you're doing a little bit of everything once in a while, but then you can go in a printer. So I think that it's all about to learn where you are, understand where you want to go, and change your mindset. When you change that priorities, then you can jump exactly in what you think and what is benefit from your practice, for your patient, from your ROI. So it's exactly that. And more focusing on this, let's try to bring some advices. So, how you consider that we can help these dentists, or what hacks you can have to help those dentists to face this challenge of the implementation of one-day dentistry? So, if there's a dentist that are listening to us now and say, Ahmad, give me the recipe, because we know dentists, we love recipes. Give me the recipe. I want to start this week. I really want to do, because I think this is the way. What can be some tricks or some hacks, some recommendation that you can give them?
I think it's like what you said about your examination protocol, and you speak about, there's a systematic way of doing this for your DSD protocol for interdisciplinary cases. I really believe a lot of dentistry is procedural, A, B, C, D, A, B, C, D. And I think the biggest hack is, focus on setting the right procedures, setting the right templates, rather than just buying gadgets. I think the most important thing is that you figure out what you want to do, what's your budget, and then someone can guide you in how within this budget you can buy the right equipment. And then after you get the right equipment, you need to understand how are you going to implement this in your practice. I think a really key part of digital dentistry in this age is that the dentist is no longer the hero. The dentist is no Superman. Okay, it is a team effort. When I say I can do a same-day crown in 1 hour, it's because if it's a simple case, I can prepare the crown within 20, 30 minutes. I think this is more than reasonable for a simple crown. And then I scan it with modern technology. This is a few minutes to scan. I design it, and then I'm hands off. I can go see other patients. I can do admin. My DA, my team is trained to do the rest. And especially for a single case, this is critical. If all the pressure is on you, digital dentistry is not enjoyable. But if you can delegate tasks to your team, I think this is one of the most critical aspects. It doesn't even have to be a same-day crown. Even if it's 3D printing, the team is important. Yes, you may start the printer, but it's critical that the team knows how to wash, how to cure, how to clean the parts, these things. Because as a dentist, you are the most valuable asset in the practice, yes, but it is not just about you. It is about the team. And your most valuable time is on the dental chair. That is where you are most valuable, where you are most useful for the business. So the less time you spend near the printer, near the cutting the sprue, near the sending the crown and putting the crown in the milling machine, the better. And these simple tasks these days can be delegated. I think an important part, I really love what you said about mindset, because I totally agree. It is like the saying, burn the boats. That means there's no plan B. You agree in your mind that you are going to achieve this thing, whatever it takes. And it is not some crazy thing because it has been done before you. Many dentists do this. Many amazing dentists all around the world do this. Now it's up to you to decide if you want to and how far you take digital dentistry. And there is no right or wrong answer. Some dentists scan and send to the lab, and that is fine. Others, they want to take it all the way, but understand to take it all the way, it is education, it is investment, and it is team training. In saying that, when you do take it all the way, it is also very profitable because, yes, there's an initial investment, but when you start making these crowns and you start making these devices, not only are you more efficient, and there's many advantages of same-day dentistry, but also the lab bill. We effectively cut our lab bill by 80%, effectively, by moving more things in-house. Of course, now it becomes a bigger topic of, again, how far do you want to take it?
No, and depending the size of your business and your goals and your type of patient, that's why we need to customize to each one. And I think we can close this episode with a phrase that we love and usually is one of the topic of the courses, and we say that digital dentistry is a team sport. And if you are doing Quadrant, you are doing interdisciplinary, and whatever you are doing, if your team is not aligned, if they are not enjoying what they are doing, and they are not capable to do the daily work, so then you can prioritize your time and take more advantage, as you said, to do what is more profitable for the practice, then you're never gonna really have the return of investment in digital. And that for me is one of the biggest mistakes nowadays in digital. People just buy the equipments and they just figure out that they have no clue how to use it, how to take advantage of that. The team is not ready how to use it, so they spend a lot of money with a lot of equipments there, and at the end they say that the digital dentistry is not as it looks like. So the reality is that they need more education to really take full advantage of that. So Ahmad, great session. I love it. I think we create a very nice tips, tricks approach from dentists that are listening to us, the dentists that want to become the quarterback of their practice, because at the end it is about that. It needs to be someone, because you cannot train your whole team with the whole information. So it needs to be one person that is like the director, that is like the midfield in a soccer game, the one that is sharing the game, is the quarterback that is deciding when onto who to drop the ball, so then they can score. So this is the main reason why we create this type of podcast. Ahmad, thank you for your time. Thank you for being here with us and sharing with us all your knowledge, your know-how, your practice, your daily work, your reality. So I'm sure that we can connect with our audience and they're going to love the content that we're sharing. So thanks to everyone and see you soon in our next episode. And Ahmad, see you. Thank you.
Thank you, Luken, and thank you again for having me on this podcast. Thanks for listening, everyone. I hope you enjoyed this episode.